7 Dangerous Diabetes Complications You Might Be Ignoring. Part 2. You wake up, feeling more tired than usual. Your ankles are a little swollen, but you brush it off. You've been busy, stressed. A week later, your doctor says there's protein in your urine, and now suddenly you're talking about kidney damage. This is how diabetes works. It damages your body silently, until one day it doesn't. In Part 1, we covered the first 3 silent complications that can steal your health without warning, including one that could slowly blind you, another that can rob your legs of a feeling, and a third that could end with a heart attack you never see coming. And if you haven't seen that yet, you'll find it linked right below this video. I highly recommend watching it first. But today, we're going even deeper. These next 4 complications, they're harder to detect and in some cases harder to reverse. Stick with me. I'll show you what signs to watch for, how to protect yourself, and when it's time to act. And if you haven't yet, subscribe to stay one step ahead. 4. Kidney damage. When sugar quietly shuts you down, your kidneys are your body's natural filters. Every day, they quietly remove waste, excess fluid, and toxins from your blood. But with type 2 diabetes, high blood sugar doesn't just float through your system harmlessly. It starts attacking the delicate blood vessels inside your kidneys. This damage doesn't happen overnight. It builds slowly, often without any obvious symptoms. That's what makes it so dangerous. Maybe you start to notice small things. Your ankles or feet look a little puffier than usual. There's more foam in your urine, or you need to go more often at night. You feel more tired during the day, even after sleeping. They seem harmless at first, easy to dismiss. But these could be early signs of diabetic nephropathy. Kidney damage that, left unchecked, can progress to chronic kidney disease, dialysis, or even kidney failure. Here's the truth. By the time most people get diagnosed, they've already lost a significant portion of kidney function. So how can you protect your kidneys before it's too late? Get a microalbumin urine test every year. This test checks for tiny amounts of protein in your urine, often the first clue that your kidneys are leaking. Keep your A1C below target, usually under 7% or as advised by your doctor. Every percentage point matters. Lower blood sugars, less pressure on your kidneys. Watch your blood pressure. High blood pressure is a major accelerator of kidney damage. Most experts recommend staying under 130/80 mmHg. Consider ACE inhibitors or ARBs. These medications not only control blood pressure, but also protect your kidneys from long-term damage. If you have even early signs of kidney stress, your doctor may recommend one. Limit salt and processed foods. A kidney-friendly diet is low in sodium and rich in whole foods, healthy fats, and plant-based proteins. Stay hydrated, but wisely. Drinking enough water supports kidney function, but avoid overhydration if you're already in later stages of kidney stress. If this sounds like a lot, you're not alone. But the sooner you start, the better your chances of preserving kidney function for years to come. If you've ever felt your ankles swelling or noticed strange changes in your energy or bathroom habits, tap like. Not for me, but to help more people recognize these signs. And if no one ever told you that diabetes could lead to dialysis, hit subscribe. This channel is here to make sure you're not the last to know. Because what's next? It might be the one complication that sneaks in from the ground up and threatens your ability to walk. Keep watching with me. You need to hear this. 5. Diabetic foot, one cut away from losing a limb. Imagine this. You take off your sock and notice a small red spot on your heel. It doesn't hurt, so you forget about it. Days go by. That red spot becomes a blister. The blister turns into an open sore. And before you realize what's happening, you're being told it's infected, and surgery might be needed. This is not a rare case. It's one of the most common and serious complications of diabetes. Diabetes doesn't just affect your blood sugar. It damages your nerves, causing neuropathy, and weakens your blood circulation, especially in your legs and feet. That's a dangerous combination. Why? Because when you can't feel pain in your feet, you won't notice a blister, a cut, or a scrape. And when blood doesn't flow properly, even the smallest wound takes longer to heal, or doesn't heal at all. That's how a tiny injury can become a diabetic foot ulcer. And if left untreated, it can spread, get infected, and eventually require amputation of a toe, foot, or more. What are the early warning signs? Numbness, tingling, or burning in the feet, dry, cracked skin, especially around the heels. Color changes. Your feet may look more red, pale, or even bluish. Swelling in the feet or ankles. Cuts or blisters that don't seem to heal. A strange smell from the foot or shoe. Here's how to protect yourself. Check your feet every single day. Look for cuts, swelling, redness, or anything that seems unusual. Use a mirror or ask someone for help if needed. Wash your feet gently each day and dry them well, especially between the toes. Moisture can lead to fungal infections. Moisturize your heels and soles to prevent cracking, but avoid lotion between the toes. Trim your toenails straight across. Don't cut too short, and never dig into the sides. This helps avoid ingrown nails. Always wear shoes, even indoors. Protect your feet from injury at all times. Choose soft, well-fitting footwear. Avoid tight or high-heeled shoes. See a podiatrist at least once a year. More often if you've had ulcers, infections, or reduced sensation. Quit smoking. It further reduces blood flow and healing ability in your legs and feet. If this sounds intense, you're not alone. But thousands of people have saved their feet just by paying closer attention. If you've ever looked down and noticed dry skin, strange color changes, or felt that familiar numbness, tap like. You might be helping someone else realize what they've been ignoring. And if you didn't know that diabetes is one of the leading causes of non-traumatic amputations, hit subscribe. You're not too late to act. Because up next, we're talking about something even sneakier. Infections that don't heal, and why your immune system may be quietly falling behind. Don't miss this. Keep watching with me. 6 infections, the tiny wounds that turn serious. Have you ever had a small cut that just wouldn't heal? Maybe it was a tiny nick from shaving, or a scratch from the garden. At first it looked harmless, but weeks later it was still red, irritated, and sore. For many people with type 2 diabetes, this is more than just slow healing. It's a sign that your immune system is struggling, and most don't even realize it. Here's why. When your blood sugar is high for long periods, it quietly weakens your white blood cells, the very cells responsible for fighting infection and helping your body heal. That means your body can't defend itself the way it used to. You become more vulnerable to skin infections that spread or recur, wounds that stay open or turn into ulcers, more frequent urinary tract infections or yeast infections, sinus infections, pneumonia, even dental issues that just won't resolve. And it's not just about getting sick more often. It's about taking longer to recover and having a higher risk of complications when you do. What you can do right now to strengthen your immune defenses. Keep your blood sugar stable. Every point above target increases infection risk. Aim for your A1C goal and avoid daily spikes. Clean all cuts immediately, even paper cuts. Use gentle soap and water, pat dry, and cover with a sterile bandage. Monitor daily. Watch for early signs of infection. Redness, warmth, swelling, pus, odor, or pain that increases over time, especially on the feet or legs. Boost your microbiome. A healthy gut supports immunity. Eat yogurt, kefir, fermented foods, and fiber-rich veggies. Practice good hygiene. Wash hands often. Trim nails. Avoid picking at scabs or dry skin. Stay up to date on dental care. Stay current on vaccines. Diabetics are more at risk from the flu, pneumonia, shingles, and even COVID. These aren't just seasonal threats. They can trigger serious flare-ups. See your doctor early. Don't wait and see if something's infected. Early treatment prevents bigger problems. If you've ever had a cut that lingered longer than it should, you're not alone. Tap like to help spread awareness. So many people dismiss this until it's serious. And if no one ever told you that diabetes could weaken your immune system, hit subscribe. This channel is here to give you the knowledge others forget to mention. Because next, we're talking about a complication that can hit fast, one that sends people to the ER in just hours if they don't recognize the signs. You need to hear this. Don't click away. 7. Diabetic Ketoacidosis (DKA), the fastest complication in diabetes. It starts with a bad headache, maybe nausea. You feel off, like your body's running on empty. You drink more water, hoping it'll pass, but things get worse. Soon you're breathing fast. You feel confused, your breath smells fruity, and before you realize it, you're in the emergency room. This is diabetic ketoacidosis, or DKA, and yes, it can happen to people with type 2 diabetes, especially during illness, missed insulin doses, or when blood sugar runs extremely high for too long. So what is DKA exactly? Your body normally uses glucose, sugar, for energy. But if you don't have enough insulin to help glucose get into your cells, your body panics and starts burning fat for fuel instead. The problem? When fat breaks down rapidly, it creates ketones, acidic substances that can quickly build up in your blood. Too many ketones equals blood becomes dangerously acidic. That's DKA. And it can be life-threatening if not treated immediately. Warning signs to never ignore: persistent nausea or vomiting, abdominal pain, dry mouth and extreme thirst, fruity smelling breath, confusion, dizziness or unusual fatigue, deep, rapid breathing, blood sugar typically 250 milligrams per deciliter, ketones present in urine or blood. If you're sick, stressed, or skipping meals, these symptoms can appear suddenly. What to do before it becomes an emergency? Monitor your blood sugar closely when you're ill, at least every 2 to 4 hours. Check for ketones if your blood sugar is over 250 milligrams per deciliter, especially if you feel nauseated or weak. Use urine ketone strips or a blood ketone meter available at most pharmacies. Stay hydrated. Drink water or electrolyte fluids like sugar-free Pedialyte to help flush out ketones. Never stop your insulin unless told to. Even when you're not eating, your body needs background insulin to avoid DKA. Have a sick day plan. Work with your doctor to know what to do when you're ill, including when to go to urgent care. Don't wait. If you have symptoms of DKA and can't keep fluids down or feel confused, go to the ER immediately. If you've ever felt off but didn't know if it was serious, you're not alone. That uncertainty is what makes DKA so dangerous, and why this knowledge is power. If this part of the video opened your eyes to something you didn't know, tap like to help more people understand this life-saving information. And if no one ever told you that high blood sugar could lead to coma, hit subscribe. You deserve to be informed, not surprised. These complications don't always scream, they whisper, and by the time they're loud, it may already be serious. But here's the good news: you're not powerless. You've just learned how to recognize and stay ahead of 7 of the most dangerous diabetes complications. Let me know in the comments, which one surprised you the most, or which one have you experienced without realizing it? And if you haven't seen part 1 yet, it's linked below. Don't miss the early warning signs we covered there. Remember, your health isn't just about numbers, it's about what those numbers are doing to your body and your life. Keep watching. Stay informed. You're not too late to take back control, one step at a time.